realized something wasn't quite right. Her behavior, her outbursts.
Now on News 2, we tackle an issue that impacts every family: mental health. From removing the stigma.
We still have many that want to stay in denial because the stigma is that you're crazy.
To treatment options.
The hardest part is getting them in the front door.
What options there are for you and your family.
Mental health and your family. A News 2 Town Hall meeting starts right now. Here's Bob Mueller and Haley Wilgus.
Good evening and thank you for joining us for this Mental Health and Your Family Town Hall meeting. I'm Haley Wilgus.
And I'm Bob Mueller. Tonight we will examine the sometimes hidden issue of mental health, reducing the stigma of mental illness, revealing what services are available to those in need. We have a panel of experts joining us tonight. We appreciate very much all their help. Commissioner Marie Williams of the Tennessee Department of Mental Health and the Mental Health and Substance Abuse is joining us. We appreciate that very, very much.
Also taking part, the Deputy Commissioner of Mental Health, Matt Yancey, and Judge Melissa Blackburn, who presides over the Davidson County Mental Health Court.
We do want to welcome you all. Appreciate very much your time for this important issue. And I'd like to really begin with kind of a topic of the mind, the topic of the discussion going on here in Middle Tennessee, the Antioch Waffle House shooting and the suspect, Travis Reinking. Family members, co-workers, law enforcement, they reported Reinking's frequent delusions, unusual behavior, mentions of wanting to commit suicide. We don't know an official diagnosis, but we do know a lot of warning signs were missed. And still, he was able to get guns that led to the murder of 4 people. The question to you experts is not how could this happen, but are you even a little surprised that it did happen? Your Honor?
Well, no, I'm not surprised. In this particular instance, based on what we know, he had unknowingly the assistance of a family member. Mm-hmm. His father, once the guns had been removed, he returned them to his son. But for that, this horrible event may have been avoided.
Commissioner?
Well, when you look at what we know the facts are, and right now there's a lot of different stories that are coming out. I agree with what Judge Blackburn said. It's really sad that a father would give his son those guns back knowing what he knew. However, what I'd say to you is in this state, one thing I'm grateful for is that we have a program called the Behavioral Health Safety Net that we're all familiar with. And so in this state, if you are poor and you don't have access to insurance, which it appears that was his case, if that's true, in this state you can get access, and I'm grateful for that.
Mr. Yancey, a lot of warning signs, but again, a lot of warning signs missed.
I think the warning signs are important, and they're signs that we all need to pay attention to. You know, one of the things in Tennessee that is really a resource for all of us is our statewide crisis line. Mm-hmm. So if you personally are experiencing suicidal tendencies or thinking about harming yourself or others, you can call 855-CRISIS-1 and have someone come to where you are, whether it be your house, whether you be at the emergency room, even at your school, to come out and do an assessment to get you the help you need. So that's an important resource that I think can go a long way in addressing things like this.
And Haley, one thing that we want to make sure that you know and the viewers know, a lot of times people go to the fact that mentally ill people may or may not be dangerous. What we want you to know is that that's not a true fact. When you look at the research, mentally ill persons are 12 times more likely to be victimized than they are to harm someone else. So we want to make sure that viewers don't go to, well, if you got a mental health issue, you're going to be violent, because it's actually quite the opposite.
But in some cases, people do act out. This may have been a case. And it gets tricky when that person doesn't want to call the crisis line, doesn't want to seek that help. So who is responsible in that case when there's someone who is exhibiting these symptoms of a mental health disorder, but they themselves, that person is not seeking treatment? Who's responsible?
Well, actually, 2 things that we'd say about that. If you're in your community and you see someone that you're concerned about, 2 things you can do. One is, if you know that person, you go up to them and say, hey, something seems to be not going well right now. How can I help you? If you go to our website, www.tn.gov, there's a whole list of how you can actually interact with the person that you know. There's also a website with mental health first aid that can walk you through that. Secondly, if it's so much to the far right or area that you're really concerned that it may be of danger, you can call the crisis number and they will come out and do an assessment, or you can call the police if you think it actually goes to that level. And in this state, we've got police that are trained in CIT methods, that's crisis intervention training, and they know exactly what to do and how to intervene.
But the key is to make that call. Don't say, I don't want to get involved. You need to get involved. You need to make that call. You need to care about that neighbor or the guy down the road or the guy in the other building. You need to make that call because you never know. You may stop that person from committing suicide. You may be the one link that can help that person get the help they need.
And building off of that too, and not all cases, but a lot of these mass shooting cases like the one in the Waffle House, we have seen there were warning signs before. And if those warning signs get ignored or get dismissed, this person is a danger to himself as well. So how do you intervene from law enforcement, from the state point of view, to get these people the help that they need? How is it available to them?
Well, that's what the commissioner was speaking about. It's that when you see that warning sign, pick up the phone and call. Ask that person if you can help them. If they don't want your help or are a recluse or a loner, seek the help for them. Don't hesitate to call and get the help for them, because you may be the one person that stops them in that trajectory down or toward that act. Make that call. Get that help.
And we saw in our setup pieces, the phone lines are there. The counselors are waiting for these phone calls.
Yes, they are. Again, 1-855-CRISIS-1. If you suspect something's going on, call that number. And also go to our website and go to TAMHO's website, Tennessee Association of Mental Health Organizations. It will list for you what you need to know and the centers that are there to help.
And I'm sure you know too as well, sometimes just making that phone call and talking with another person can stop an act or be the momentum to get treatment.
I think you're right. And the thing about mental illness, 50% of mental health issues, the symptoms are usually seen by the age of 14, 75% by the age of 24. So I think it really speaks to generating awareness around our young people, educating people in the community, educating our educators around mental illness so that they can identify and get folks help early on. We know that can be a very powerful way to circumvent tragedies like here in Nashville.
And then Judge Blackburn, what do you see as the best course of action to prevent someone who has a mental illness and may be a danger to themselves or others from getting a gun?
Well, I think one of the best ways to do that now is, and I'm going to let the commissioner speak to it, there has been a new law passed this week, this very week. And she's better equipped to speak on that law than I am, that I think will make a huge difference in Tennessee.
Thank you so much, Judge. Again, I want to go on record to say not all people with mental health issues are dangerous. However, in the event that someone is adjudicated in one of our institutes or a psychiatric hospital, what happens now is that those staff are to notify the local law enforcement, which we do and other hospitals do. The new law requires that if that person goes to purchase a gun somewhere in the state of Tennessee, that the TBI is then to notify local law enforcement that they've gone to try to purchase the gun. So that's the new step that's been put in that law.
Our discussion just beginning, absolutely. Yeah. Stay with us, our town hall meeting, Mental Health in Your Family, just getting started. We'll be back in a moment.
For a man, especially African-American men, in our communities, we don't necessarily believe in counseling. You know, we can handle it ourselves. We're good. We're the rock, you know, but it's okay to have strength and say, you know what, I need help. That's where strength is.
Titans legend Eddie George talking about his struggle with mental health. He says when his NFL career ended, he struggled with purpose and identity. You can hear his full interview tonight right here on News 2 at 10.
And welcome back to our Mental Health Town Hall. We are meeting with our guests tonight. And one of the things that Eddie George touched on there was the stigma of treating mental illness, of seeking treatment, the way that you think you'll be perceived by others. So that's something that, Marie, a lot of people struggle with getting over that stigma.
Absolutely. We have a great program called Erase the Stigma. and where we try to work with people to understand that we're more than our diagnosis. Treatment is effective, recovery is real, and that just like if you had diabetes or you had a heart disease and you had to take medicine for that, it's exactly the same thing if a person has a diagnosis of depression or schizophrenia or bipolar or anxiety or any of those items. It's simply a diagnosis. It's not the person's identity. And I really appreciate Eddie George and what he's saying, because he's making it actually more understandable and breaking down those walls of stigma by coming out and telling his own story. Matt, what would you say to that?
You know, I think as a department, our mission is to increase easy access to high quality care. And I'm of the opinion that stigma is the biggest barrier to access. So as the commissioner mentioned, it's something that we have prioritized, working with partners like Mental Health America of Middle Tennessee. We work with NAMI across the state to do anti-stigma campaigns to generate awareness around mental health and mental wellness. I think we are becoming more and more astute to the fact that there's a reciprocal relationship between your mental health and your overall physical health. And we're seeing people across the state better understanding that. Our medical community is understanding that. And as a result, I think more people are going to get the help they need.
One of the biggest aspects, too, of the stigma is the shame factor. And you heard someone as successful as Eddie George talk about that. And I'm sure that there are a lot of people who come to you feel like they did something wrong to get them in this position. How do you overcome that? How do you bring them back up and say, this isn't your fault, this is an illness?
Yeah, well, what we try to do, another thing that we've been doing is with the Tennessee Mental Health Consumers Association. It's one of the biggest new programs that we've implemented. That we've got peers in our hospitals, so 50% of the people that come into our inpatient hospitals are new to the system. Sure. We have peers with real lived experience that meet that person and say, hey, look, I'm in recovery. I was here before. And so we try to address it when a person comes into the hospital, because we know that that shapes that person's belief and thought about what their next steps will be. And in addition, we've got a faith-based initiative where we know a lot of churches may not understand the brain disease of mental health issues or addictions. And so we're increasing that information to those congregations and houses of worship as well.
And is that something that's important, that we learn more about what mental health really is, that it is a medical diagnosis? Is that something that is really part of this, breaking down what this kind of illness is, that it's not just something that you created in your own mind?
Right, Judge?
Yes, it is. And that's something that I have found in the last 3.5, 4 years on the bench, is that looking at the young adults that are being arrested and coming through the court system, I think we could have stopped a lot of them on their trajectory if we had been able to diagnose them, as he said, the deputy commissioner, when they were 14, when they were 15, when they were 9 or 10, when they were acting out in school that really probably wasn't misbehavior. They weren't being bad kids. It was some type of mental health need that was not diagnosed. And if we had been able to take the time and diagnose those students as they were coming through school, get them the mental health treatment they needed, they might not have dropped out of school because their mother, dad, grandmother, whoever, stopped going and picking them up from school because they got tired of having them kicked out of class.
Early intervention
They
can
stopped
make a
sending them
huge,
to
huge
school.
difference.
Yeah, so they never graduated high school, don't have a degree. They started picking up charges because they weren't going to school. And now here they are in court with an arm-long list of charges, boys and girls both, that they didn't have to pick up if someone had just taken the time to see what's really going on with this kid. This kid really isn't acting out. Something else is going on. And sought treatment back then and changed that trajectory, allowed that child to graduate and maybe go on to college as opposed to starting picking up charges.
Great advice, great advice. And if you know someone who is struggling with mental illness, if you think, especially a child, someone in your family, please go to our website, WKRN.com. We have several resources posted. Just click on the mental health tab right there on our website. Our town hall meeting continues after this.
You're watching Mental Health and Your Family, a News 2 Town Hall.